call to order. Let's have the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, let's have a roll call.
Chairman Fletcher,
Present.
Glenn Bailey, Dr. Johnson, Commissioner Cowles, Commissioner Bertling, Dr. Noland, Peggy Cavala.
Okay, public comment? No public comment? Well, then I'm going to take this opportunity to make a public comment. So, yes. I wanted to present to you last time some information on AI. So AI is a big deal. We're all reading about it. And you can have optimists. Can you just go full slide instead of you slide? Okay, so you have optimists who believe that perhaps AI is going to somehow enhance the human condition. How that happens exactly is not certain. Next slide, please. And you have, and you have pessimists who feel like AI may be the demise of the human condition. And we're right on the cusp of this new technology. I'm not going to stand before you to give you my personal impression as to what the ultimate outcome will be. But there was a very important, next slide please, a very important article that came out about 2 months ago from the MIT Media Labs. And they ran a fairly simple experiment. They took 75 students, broke them up into 3 groups of 25, and the experiment consisted of instructing the students to write an essay. And the topic of the essay was harvested from the SAT exam. And all 3 groups, group A, B, and C, were all given the same essay topic. And then they ran the essay exercise several times so that they could accumulate data. They didn't just do it once. They had 3 different, they had the essay writing occur on several occasions. Next slide, please. So while the students were writing the essay, they were hooked up with EEG leads to the head that detect voltage changes depending upon the activity of the underlying brain tissue. And in one group, the students were requested to write the essay on their own. In another group, they were asked to write, again, the same essay. All groups are given the same questions. But they could use AI for research. They could use it as, an assist. And in the third group, the students were allowed to use AI to construct the entire document. And then they could come along afterwards and edit the document and personalize it and make it their own. So there's your experimental protocol. Next slide, please. So when you are thinking and you have all the electrodes on, you have an electroencephalogram that is keeping track of what kind of activity is going on in the brain. And just as geologists and geophysicists can use seismic information to reconstruct how the Earth is structured down below by kinetic energy of earthquakes, pinging and going around in the interior. So you can use Fourier analysis with an EEG tracing and map out a three-dimensional structure of what kind of activity is going on inside the brain. It's a similar mathematics. Next slide, please. All right, so here's the money slide. So what you're looking at in the category of students that were asked to write the essay without any assist of the computer, you will see that there are paths of neural transmissions, nervous activity, neurological activity inside the brain. And the orange indicates higher intensity of networking going on in the brain. So this is the group, the cohort, that had to write it all on their own. The middle cohort are those that were allowed to use AI for research. And the third cohort, large language model, used, and by the way, they use ChatGTP, were allowed to provide a token, a prompt, to ChatGTP, and then Chat would give them an essay, and then they could sort of modify it. Now, I think from where you're sitting, you can see there's a whole lot more orange for those who had to do it themselves than for those who had it done for them. Next slide, please. And indeed, you can sort of read this, but in effect, this is in language what you saw in that picture. The more you demand of the brain to work, the more it works. That's intuitive. Next slide, please. And so there's a trend towards basically the brain sort of, getting lazy. And we all know this. How many telephone numbers do you still remember versus when you were a child? You see, it's insidious. We get reliant upon, these little digital devices, and we don't even know it. Next slide, please. Well, I mean, some of these are really pretty stunning. I mean, you can't even remember, and this is intuitive. You can imagine that if you actually wrote something, you would remember what you wrote. If the computer wrote it for you, why would you remember? I mean, this is intuitive. But indeed, they quantified it. Next slide, please. And actually, let's just go to the next slide because this is the slide. This is the slide. So then they took, now remember this one. Then they took the cohort that allowed ChatGTP to do the writing. Went through several essays. Then they took those 25 students and asked them to write an essay minus AI. Now you have to do it on your own. And guess what? It turns out that they remained below baseline. In other words, they had lost some measure of cognitive ability. Now, you might ask, well, but Thomas, what if you continued to train them and they kind of built back up and they could ultimately regain what they had lost in this simple little exercise? Perhaps so, but it's striking that there was any lingering cognitive decline. I find that striking. Next slide, please. Now, we like to think that the age of the machines, Arnold Schwarzenegger, Terminator, or 2001 Space Odyssey, that the machines are going to take over. You know what? It's probably going to be not that dramatic. We're just going to stop thinking. Next slide, please. Those of you who are old enough may remember an old public health message in the era of Margaret Thatcher and Ronald Reagan. You remember the effort to try to get kids off of drugs? I just updated it for you. Any questions? There you go. That's just one article, by the way. I'm not reporting that this is true. I'm not reporting reporting that I know how this is all going to turn out, but I got to tell you, this was a pretty sobering article.
Dr. Fletcher,
Yes.
how do you apply this, or would you think on the public health model of prevention and disease prevention and community health, and any ideas on potential applications to?
Well, it's interesting. Now, I do follow that literature. There have been a number of studies that have looked at AI versus doctors for clinical acumen, for diagnostic acumen. I'm sorry to say, but AI beats us every single time. If you take just the case of the week from the Journal of Medicine, which back in the day when I used to practice medicine, I would in fact do the case of the week out of the New England Journal of Medicine. In fact, back when I used to work for a living, I read the New England Journal of Medicine. Doctors can only answer about 20% of them. AI can answer 90% of them. And apparently it's not just medicine, it's in law. I mean, the day is going to come, or CPAs, or you name it. The day is going to come when the AI is going to be better than we are.
Well, Dr. Fletcher, I agree that there's aspects of that there where it could be useful and could be not useful, but I mean more on, is there a way to possibly intervene with the decreased neurocognitive capacity that you're saying might be a result of increased use of AI from our public health preventative model? Is there a way to intervene to restore cognitive function, or to educate the kids in a way that we figure out how do we minimize the detriment?
Are
We
you
don't end
saying,
up
is
with an
there
empty
something
frying pan.
that can come out of Panhandle Health that would be instructive to the populace?
Yes.
That we could help them?
Yes, exactly.
Well, maybe. I can tell you what I do, but this is just me. And I've been reminded by many people that I don't speak for the board. So I'm just saying this is just me. I use AI. I don't not use it. It's actually quite handy. I never let it generate product. And in fact, I force myself to write every single day. And it never writes for me. What I use AI for is in that middle category. I give it a question, and I make a point of making the prompts as specific as possible. I don't ask general prompts. I ask very specific prompts. I'm looking for a specific answer, and then I compare Grok with Perplexity. Those are the two, and Brave are the three I use. I don't use Chat. I don't use Gemini or Claude or Entropy. There's plenty of them out there. That's what I do. It can be useful. I'm not saying that it's powerful. It comes up with some amazing stuff.
Have we thought about how it'd be good to hear at some point how the Panhandle employees are starting to utilize in pros and cons and issues that are coming up where it's beneficial in areas where we've kind of caught and they said, oh, it's not quite, that actually caused the problem. Or, because I mean, in playing with it, you can always find it either trying to please you and such that it kind of tells you things that aren't exactly true, but it thinks that's what you want to hear. So, so there is like this kind of people pleaser that can happen too. So it'd be interesting just on how we'd want to like being proactive. It's not really probably for right now, but being proactive with how to utilize that and or contain it, and so that it actually serves well for us since it's everywhere, right? So.
Okay. Any other questions, comments, concerns? Fine. Let's consent agenda.
Thank you, Mr. Chairman. As we have at our typical meetings, we do have draft minutes from the last meeting. We do have division reports from our program leads, as well as fiscal reports. Grants contracts that have been recently signed are listed. The opioid prevention grant that funds a staff person to work collaboratively with local law enforcement and EMS to address hotspots for overdoses and also outreach efforts. It's a larger of the four listed today. The remaining three are smaller amounts that we received from the Area Agency on Aging, and they help support the diabetes pitfall and caregiver program.
Waiting for
Any
reports.
questions? Zach?
Any questions? Are there any, so we're going to, you presented your consent agenda.
Yes.
Got it. Okay, any extractions? Anyone want to talk about any of these items in particular?
You mentioned that that someone's coordinating with the EMS and such for all that. Could you mind just expanding on that just briefly for a little bit more?
Do you mind if I use the
So our OD2A subgrant funds one full-time staff member. They run our public health and safety team, and that's a collaboration with local law enforcement, EMS, and a CDC person, and they do track data as far as overdoses in District 1. That person also distributes Narcan. We have 2 Narcan vending machines. They also distribute harm reduction tools such as medication lock boxes and medication disposal pouches.
So is that funding, is that associated with the, the Purdue Pharma money, or where does some of that money come from?
The OD2A grant is directly through DHW. The opioid settlement funds are from like the Sackler family and Johnson & Johnson, and those are settlement funds. Those are separate.
OD2A, just so I know, what does that stand for?
Overdose to action. Yep.
One more question on that. With the findings from that information, what are we doing with that as far as being proactive or trying to find where the most vulnerable or likely to be susceptible to that, going on? Is there like a proactive steps that are occurring, or is it more kind of post assessment, post game assessment versus trying to take that and develop a model that would let us know where to look before it happens?
I can speak in very general terms to that.
Okay.
So right now we are looking at post-overdose data. So that will come directly from our emergency responders. So we're hooked into an OD map. So that is a national map. So it's an opt-in. So we do rely on emergency responders to opt into that. Most of the ones in our region are opted in. So we receive data on overdoses, and then based on that data, we can see what substances were involved in that data. And then also we can see if Narcan was administered and by whom, and if that person was taken to the hospital.
It does help. In doing that, that's still kind of the post assessment. Is there any thought, or it's been a discussion on how to use that to model where to go and how to intervene, and maybe how to affect community health and education stuff to kind of lead that away so that those numbers start to really crank down over time? Or
Absolutely.
what would you think on that? Or
Yeah. So one of our goals right now is hiring a care coordinator. So that care coordinator would be going out and do post overdose intervention. So that person would reach directly out to the ODs that we're seeing in our region to provide support to connect them with recovery and treatment programs.
thank you. One other thought would be that, and I think I mentioned this before in a previous meeting, but where we possibly try to overlap with the coroner information and data on that level too, to then really develop a system to do more root cause assessment of what led to the overdose even being an issue in the first place.
Absolutely.
Why the use was occurring, and then going to develop. Is that something that maybe we can look at working on in the future, or bring it up as like something to discuss or bring about? But appreciate your input. I just wanted to say that I think that we have somebody.
Yeah, in fact, I was going to bring that up, we're very much in tune with, following fentanyl overdoses, et cetera, and whether or not they become land bias cases, et cetera. So we're aggressively working with law enforcement so that if we suspect that there are higher levels, even when there's multi drug involvement in a death case, if it's the metabolites are mainly from fentanyl, they can go after a limb bias case. So we're very much on top of that. That's why we bought machinery to go after that. So we're very knowledgeable on that, and we might be able to contribute valuable information. So.
Yeah, thank you for doing that.
Mhm.
Thank you, Dr. John.
I actually have a question about the Narcan. Are we the only suppliers of Narcan? Do we have any idea, like, if Narcan is used, how would we know that we cannot supply?
Yeah, so the vending machines actually have software inside of them so we can track that data. Other vending machines, not other vending machines, sorry. There are other options for distribution of Narcan, which we are also investing in. And those are more of like a newspaper stand where someone could go and open it, take a Narcan. What we would do there is just track how many are taken out, and we would have numbers. But as far as that box being used for a case in our region, we wouldn't necessarily know that. I guess the most important part is that people are using Narcan and that Narcan is widely distributed.
So what Peggy, you're discussing is, do we know if it's actually being effective, or are we actually getting it to the
Well,
end? I mean,
I had multiple questions there. One being, are we the only supplier of Narcan?
Sorry.
And yes, how would you track?
We are not the only supplier of Narcan in our region. So Kootenai Fire has a contract with the state, so they receive large supplies of Narcan. So organizations can go to them to receive a larger amount. We do keep some on hand here at the health district for individuals if they needed it. But we also supply Narcan to pharmacies in our disposed lot carry program, and then we also supply it to first responders for Narcan leave behind programs. So those are for people who might be at high risk of having an overdose. A first responder can leave them with a Narcan rescue kit. Does that help, Peggy?
Well, it does, but I'm just trying to figure out, like, if it, again, is there a way to track between the two? I mean, if a life is saved, that's important,
Yes.
but, the interesting is to know.
No, I agree. That would be interesting to know, but no, we aren't able to track each and every single box.
The one option to possibly look at would be, development, or there may be one out there, but of some sort of app with, and that even encourages some anonymity in a sense, but for reporting for overdose, because like we've discussed, is overdoses that occur but never go to the hospital.
Mm-hmm.
No one ever technically records it.
Yeah.
And so, where as a friend that sees their friend overdose or something, could be like, okay, we can report it, but in a way that they feel safe. We'd have to figure that out. And then also, if there was Narcan use, they could have a little scan me, let us know this was used, so we can put more out. Kind of like encouragement on there that they can take pictures, scan it, and say, guys, if you want to stay
Yeah.
with this. And you would obviously be volunteer reporting, but
Absolutely. Yeah. And Idaho does operate under the Good Samaritan law. So if someone did help someone by administering Narcan, they are at no fault themselves. So. Okay.
Any other comments? So I will entertain a motion to accept the consent agenda.
a motion to accept the consent agenda.
Do we hear a second? All right. In my usual fashion, any nays, please raise your hand and make yourself understood. All right. Absent that, let the minutes stand that it was consent agenda was approved unanimously. Item 6.
Okay, thank you. My name's Jason Pepin, the Environmental Health and Protection Division Administrator. I just want to take a few minutes to discuss the sewage management agreement that we have in place with the City of Dalton Gardens. And really, before I get into the sewage management agreement itself, just want to step back and kind of frame that specific agreement within the larger context of the Aquifer Protection Program. And Jessica, can you go back to the beginning, please? Okay, sorry. Okay, so yeah, I wanted to discuss, the Aquifer Protection Program and really just provide some education on, the aquifer itself. So when we refer to the aquifer, the Spokane Valley, Rathdrum Prairie Aquifer, it's a really important resource for our area. Sole source aquifer at this point, up to 600,000 people between Idaho and Washington, encompasses 370 square miles. Essentially, it does extend a little bit into Bonner County, but essentially from the southern end of Pondere Lake down through the valley in Kootenai County and then into Spokane itself. And in addition to the vast amounts of water that flow through this area, the aquifer is highly susceptible to contamination, largely because there's no confining layers in the soil. It's between the ground surface and the aquifer itself. It's mostly sands and gravels. And then there's also extensive development over the aquifer. So on the left-hand side, we have an image just showing an overlay of the aquifer boundaries. And then on the right, just to kind of drive home the point of the level of development that takes place there, with our drinking water directly under our feet. So just want to start the discussion there. And then, transitioning to our aquifer protection program, really this is a legacy of Panhandle Health District. And this program was really born out of a grassroots effort in the community formed by an ad hoc committee to address groundwater quality concerns in the Spokane Valley, Rathdrum Prairie Aquifer. And, looking back through the lens of 50 years of history of administering this program has really led to, successful development. Sometimes people may say even too successful of development, certain groups that we meet with, of Kootenai County, while still preserving and protecting this valuable resource. The other point I'd like to make is that this is one of two unique programs of Panhandle Health District, both of which were born out of, local issues, and the programs address those local issues at a local level with a vast amount of community involvement, partnerships, collaboration, and support. The first of which would be the Institutional Controls Program, or the ICP, which in that case, really comes out of the Superfund site in the Silver Valley. And one of the main functions of this Institutional Controls Program is just allows for, again, community development within an active Superfund site. And just really scratching the surface here with ICP, but leading to a significant reduction of blood lead levels in children, going from levels that are among the highest in the U.S., if not the developed world, to being below the national average now. Management of contaminated soils on properties at no cost to property owners. And contamination is still there, but within that community, things like the Silver Mountain Gondola Base, a lot of those types of developments would not have been possible without the work that the Institutional Controls Program does. So moving on to the Aquifer Protection District, this is kind of on the flip side of that from a preventative standpoint. In Aquifer Protection Program, built in the 1970s, again by an ad hoc community of Kootenai County representatives and community members, and just a wide array of the public, and really in response to the trend of elevating nitrate levels in areas of high density septic systems. And some of the basic functions of the Aquifer Protection Program have been to limit septic density and require connection to sewer for high density development. And so that's an important point to make, again, looking back over the last 50 years. This isn't a mandate that they all have to be 5-acre parcels. what this has done over that time is that's allowed for proliferation of extensive sewer systems throughout our area that have really helped to serve the development in a way that has translated to, actually improved water quality. I'll get to that in a few minutes. The other important component of that is regulating chemical storage and handling directly over the aquifer at businesses. And just to kind of give you some context there, total about 21 million gallons and 11 million pounds of chemicals at and also we also regulate non-domestic wastewater disposal. But just to kind of just set the stage, and all of these programs that we discussed, these really function to serve gaps in the statewide rules. That's one of the main benefits that we serve as a health district, and we're perfectly suited for that. Being integrated in the community, working through that, working through these issues. And so within Dalton Gardens that we'll discuss in a few minutes, we have 97 regulated facilities within Dalton Gardens. And the measures that are taken at those facilities are very basic, reasonable measures, things like secondary containment, covering fuel pads, all to just minimize contamination from chemicals. We also have a robust aquifer sampling data set, which is really important over time. We have 50 years worth of data. We sample a wide array of constituents, and that really allows us to monitor for emerging concerns and then to be able to deal with them effectively at an early stage. and so, rather than waiting until the aquifer is contaminated or there's a large problem, we're able to see that early on. We sample 28 public wells 3 times a year, and we have that data for that entire time. And really, this is a key point with the aquifer protection program and institutional controls program as well, is that these programs are founded, operate entirely on collaboration, partnerships, and education. I mean, that's really what is the foundation of these programs, and that's really the key to the sewage management agreement that we discussed. And they also involve extensive community outreach to make sure that the public is involved in these processes. So I also wanted to discuss briefly, just to help, again, just zoom out a little bit more and just discuss this within the framework of the state of Idaho. One of the reasons for the septic density requirement is that there's a gap in the statewide septic rules do not address septic density. That was a known concern in the 1970s that still exists today. And for various reasons, there's currently 35 nitrate priority areas across Idaho, and what that means is that these are groundwater supplies that meet or exceed the EPA action level, federal action levels for nitrate, which septic systems are one contributor, there's many contributors to that. I just want to point a few things out. I think it's important as board members, just to kind of be able to review this. And so within the state of Idaho, the image on the left shows the 11 major aquifers within the state of Idaho, ranked 1 to 11 in terms of the susceptibility to contamination. So the Raptor Prairie Aquifer is the third most likely to be contaminated. The image on the right is the nitrate priority area. So again, there's currently 35. The most recent one is in the Lewiston area. And one thing that really stands out if you look at that slide is that there's no nitrate priority areas within the Panhandle Health District region. And I just think that's really a testament to this program and the work that goes into it. Yes.
Jason, what leads someone to become a nitrate priority area? Like, what's the criteria for that? Or
it's essentially elevated nitrate levels in the groundwater, and through a number of samples, goes through statistical analysis. So it's not like they just pull one sample. This is over a period of time.
So it's just crossing over a certain threshold that's set by the state, and then it automatically pops you onto it.
Mm-hmm. Yeah, and then exactly, and then within this, and especially as you start, working through, what it takes to remediate those aquifers or what the impact is to the communities, it's extremely difficult to remediate groundwater once it's contaminated. In some cases, almost impossible. And so that's really where this program, shines. Is that this is a preventative program, highly successful.
Jason,
Oh yeah.
if I may, also too, why, if our nitrate levels are going down, why would we be rated the third most likely? I don't understand that.
As I mentioned before, it has to do with the composition, because there's no confining layers. Essentially,
Structurally, then you mean structurally with the ground?
Exactly, yes.
Oh, okay.
Yeah, so it's a,
Dr. Johnson, like a confined layer from my understanding is like there could be basalt caps and
Thank you,
different
yes.
non-porous materials that can
Okay.
cover parts of an aquifer.
Mhm.
And so if that exists, then it will deflect contamination that happens above it.
Mhm.
Whereas we have pretty much zero as far as we can find. So it's basically just the sand, the gravel. So everything you throw on the ground goes straight into the aquifer.
Got
It's
it.
not that deep. So
Okay, so it's rated that way because of the structure, but not
Mhm.
because of the, the reality of the testing. Okay, got it.
yep, absolutely. Yeah, and then on the impact to the communities, and this is something that's really, that is very real for much of Idaho, is that both on the drinking water side and on the wastewater side, requires extensive and expensive um, treatment of both the drinking water and the wastewater. For example, in the Lewiston area, with the most recent one that I mentioned, as they're looking into property owners drilling wells in that area, they're having to drill wells that are now going um, up to 1,500 feet deep. So the well cost is going from $30,000 or $40,000 to $150,000, and it's the same thing on the wastewater side. Yes.
Jason, also, have you been able to identify, or they identified what are, say, like the top 5 reasons for increased nitrate contaminants in each one of the areas, so that we can then look into that, and then that's part of our intervention strategy? Or
Yeah,
not?
thank you. That's an excellent question, and that's part of other than designating these nitrate priority areas, the groundwater protection areas, and there's an assessment of that. And there's various reasons for that. Obviously, in Idaho, there's a lot of agriculture. There's agricultural impacts, but in the most recent example, using things like caffeine tracer dyes and other things, they've been able to attribute both elevated nitrates and then also degradation of nearby surface water directly from high density septic systems. So yes, that's part of the analysis, and I could get you more information on that. That's really not in our wheelhouse at Panhandle Health District, but I have access to.
Is the septic itself just based off of the breakdown products that happen, or is it more, it really depends on the inputs and chemicals that are going into the septic from just human use other than waste?
It could be both, and that's a really big question within the wastewater world. For example, pharmaceuticals, other things like that may not be broken down in soil. But in this context with nitrates, this would be nutrients directly from the septic system. And with septic systems in general, every one of them are discharging hundreds of gallons of wastewater every day into the soil. And soil can do an amazing job of treating and removing pathogens, nutrients, and so forth. But and this is whether it's within Idaho, anywhere else in the rest of the country, when you have high density septic systems, the cumulative impact can start to add up. And again, that's something that's not addressed in the state of Idaho, and largely because it's a diverse state geologically. It's hard to apply these broad sweeping standards. So just before this meeting came from another meeting where the state's now trying to give counties and other planning departments, do analysis that would give them data that would determine, what level of septic density was required, so they can make appropriate land use decisions.
One more question on that.
Yeah.
Do we know, are all septics, and that's what we're trying to get is like, what makes a septic system a low nitrate generator versus a high nitrate generator, or is there a way to differentiate those things?
Well, so part of that comes down to the use. Honestly, every septic system is used differently, and so they're just by the nature of them being used, that there's going to be nitrates and a whole host of different nutrients and other chemicals there, and that's really what happens in these other areas, is they have to put in nitrogen reducing septic systems. The way that the statewide rules are essentially structured when it comes to individual septic systems is that level of treatment or that assessment of the cumulative impact of individual septic systems really isn't required unless the underlying groundwater is contaminated, which seems sort of backwards, right? So we're going to wait until it's contaminated until we do these assessments. So, but back to that point, yeah, that's how it's addressed in these areas. Is they're required to put in really expensive and costly operation and maintenance standpoint nitrogen reducing systems to limit the amount of nitrogen going into the systems into the groundwater. But we don't have any of those within our.
We don't have a need currently, or just hasn't been identified, or as far as we know?
Well, in terms of the nitrate
The nitrate
priority
reducing systems, does that only come on when you pop over into a nitrate priority area, or where that becomes a requirement, or is that?
Yes, with the exception of what we call a central system. The threshold is about 10 homes, or the equivalent of that. And it's called the nutrient pathogen evaluation is required, which assesses the impact on water, and then also, more importantly, to the neighboring parcels of that groundwater. And if it exceeds a certain threshold, then treatment levels are required based on that. So that'd be the only example within our area that this has been applied.
Okay, thank you.
And then, yeah, just to kind of drive this point home, this is just an example of one of the wells that we do sample, and just showing, nitrate concentrations over time, starting about 1983, and, a trend line decreasing. And I just really think it's important to recognize that, this is all taking place at since that time, when we have about 5 times the population growth directly over this aquifer. And, just even the meeting I was just in, so that's almost miraculous. That's very uncommon. And also important to recognize that we're doing this as regulators in one of the least, if not the least regulated state in the country. That's not an easy thing to do, but it's critically important.
What do you attribute to the not increasing the nitrates over that time, increasing with the population?
Very big part of that has been limiting septic density extension of public sewer into those areas. So some of those same areas that we're seeing the elevated nitrates now have much higher density of housing directly over them. And again, this aquifer sampling is a really big component of this program for the entire community, because that's really how we can, assess the effectiveness of things like stormwater systems. And the surrounding cities have been fantastic. It's the partnerships and, being able to approach this in every different way is really, there's a lot that goes into it, and the public as well. So just a lot that goes into all of this. And so now moving on to Dalton Gardens, again, going back to our map of the aquifer, and then zooming out on the city of Dalton Gardens. So the city of Dalton Gardens is a unique community. I'm just showing you here for those of you that may not know. So it's right kind of between the city of Coeur d'Alene and Hayden. And so this would be the city of Dalton Gardens. And then I put a box here that we'll talk in a minute about the commercial properties, but it's a combination of residential properties, commercial properties. And then also important to recognize that, being located directly over the aquifer, there's always the potential for contamination of other source water. So what this red crosshair represents that's the city of Coeur d'Alene public well. Zoom in on that, and you can see that this is it's called the source water capture zone, just showing where the groundwater that that well utilizes is captured from. And really, the main point I want to make there is just that all these dots represent different potential sources of contamination, and just everything, just that all the activities above the surface that could impact these wells. That's really kind of the context of this discussion. And then moving on to the Dalton Gardens sewage management itself. This agreement has been in place since early 1990s, and it's an agreement between Panhandle Health District and the city of Dalton Gardens. It's reviewed and renewed every 5 years, which really allows for opportunity for adjustment if necessary, or any potential changes if we run into any issues. And it really has, over that time, has really solidified the relationship between the city and Panhandle Health District. As example, we took part in their Dalton City family picnic this weekend, and provided some education outreach to the edible aquifer, and just really good opportunity to interact with the public in a very positive way, and just provide education. There's several other elements that I probably don't need to get into, but mainly it maintains the existing septic density, when the aquifer rules first came about, and also allows them to preserve their rural nature. And that's part of why they wanted to do this. If you drive around the area and you see all of the surrounding areas are highly developed, Dalton Gardens is still this quaint community, and that this is all part of that. It also prohibits the discharge of non-domestic wastewater. That's another gap in the statewide rules, and through our critical materials program, we can identify those and address those. And then within the scope of this current sewage management agreement, this next 5-year cycle, this last point is going to be really critical, and that's that within Dalton Gardens, again, there's the residential properties, the commercial properties, and the city of Coeur d'Alene has extended a sewer line up Government Way. And then there's a 15-year deadline for businesses to connect to sewer. And that's going to take a really strong partnership between the cities of Coeur d'Alene, Dalton Gardens, and Panhandle Health District to make that happen. So that's something that, you know, it's going to be really a big endeavor in that area, but really translate well to, you know, both groundwater protection and then also just, you know, allowing for, in a lot of cases, expansion of their businesses and so forth. And then within this as well, the existing sewage management agreement going back to the 90s, anytime a facility would, if they do have a source of non-domestic wastewater, they need to connect the public sewer or if their septic system fails. So it kind of just provides a mechanism to get properties connected to sewer, or if they want to expand, subdivide parcels, anything like that. So that's all I had for this. Just wanted to end on this picture of this cute kid drinking a glass of water, because I think it's, you know, it's just important for all of us to recognize that, you know, that we need to protect these resources, so that, you know, we pass on, you know, we get to benefit from the future generations. So any other questions, comments? No? Okay.
Jason, I have another quick question. As far as this is saying that the city is doing the maintaining of it, so is the purpose of the agreement more of supporting them in a management plan, or do we actually do direct monitoring? It looks like they're doing that themselves according to the agreement. Is that right?
Well, they monitor the water usage,
Okay.
which has actually been very beneficial, because a lot of times what that has translated to is leaky, you know, they could have leaky fixtures, water leaks in there. That helps us address that. And they have a whole mechanism within that. And that's the other point I wanted to make, is that the elements of the sewage management agreement have now been codified in Dalton City Code, including that. So they manage, it's a true partnership. There's things that we do, there's things that they do. We meet with them often, and we're very tightly integrated in these elements.
Thank you.
All right, well, thank you. Thank you, Jason. We can move on to agenda item number 7. Kim, before you stand up, though, some of the board members have time limited, and this is potentially going to be a long meeting. So either, here's your option. You can either abbreviate it, or we'll give you all the time in the world for the next meeting. What would you prefer? But it's time sensitive. You're gonna vote.
No, she's saying that potentially waiting if that's needed.
Oh, you would prefer to wait. Oh, perfect.
And-
Oh, okay. Perfect.
And
I'm asking,
I concur, because that program has a lot of depth and
and it
breadth to
should,
it.
and I want to
so
give you
it
your
needs-
time.
needs
I mean,
proper time.
I'm on your side. I'm trying to actually be your friend here. All right, is that okay? I know that there are rules. We have our lawyer here, and of course, we're going to get lawyered up. But, you know, when you have an open meeting, you have an agenda, and you can't change it unless you have permission or whatever. You'll, okay, do I hear a second? Any objections? Hearing none. Thank you, Kim. It's been tabled, but we'd love to hear you next time. In fact, we'll put you number 1. Okay. All right. Item 8, and that is the board training. This was actually something that Peggy had brought up, and we decided we would, you know, have a discussion as to board training and who should do the board training. And then I had invited everyone to sort of think about it, and I did my own research, but let me hear from others on this topic.
If I remember correctly, wasn't the Idaho Association of Counties considered one of the options?
Well, it is. So I reached out to Seth Quigg. Well, actually, back up. I actually reached out to several commissioners and asked their opinion as to this training. And the not near universal, the universal feedback I received was to go with IAC training.
Mhm.
And so I reached out to Seth Quigg. He emailed me back. Do they have that correspondence? It's in your packet. So Seth emailed me back and said that indeed IAC is planning to provide for commissioners, for tax boards, for all kinds of other boards appointed by commissioners, a training, board training this fall, in October. Right.
Right, and yeah, in fact, the reason I brought it up is I was sent an invitation.
Oh,
and-
to go to it.
To go
right.
to it.
And probably, so my arguments in favor of going with the IAC program is, number one, you can't beat the price because we're IAC members, we get it for free. And number two, it puts us all on the same page. In other words, the commissioners get the same exposure, the coroner, everybody gets the same exposure, so we're not receiving different messages from different training programs. So
And
I
if-
think that's an advantage.
And if I understand the email correctly, because I did sign up for it, that they were doing about 6 different locations in the state, and the only one in the north is in Coeur d'Alene on the 28th of October.
Correct.
Right.
That's correct. So it's coming up. Any other, Peggy?
So, I guess my concern about, and I think, certainly having training that commissioners are going to, and we're all on the same page. But if we get into an issue with violation of anything with open meeting laws or procedure, I'm familiar with attorneys providing that education. So I would just throw that out there. It seems like, and our attorneys here, so they could weigh in on that, but it seems maybe the Southbridge training would be appropriate, and then possibly other training by legal counsel.
If I may comment on that, the IAC has a legal department that will be leading this, and so they're be very much involved in the presentation.
And they would be, if we had a violation or anything such as that, they would be the people that would be involved in that.
Well, I mean, I'm just talking about from an instructional point of view. The instruction that they'd be providing would definitely be guided by the legal team associated with IAC.
If I could comment on that, is my thought is that they're the standard for all of the counties in Idaho, and so the way I understand it is that according to for commissioners, the state law requires that the counties, work with an independent and the local, usually prosecuting attorney in the county is going to be the one who takes up the legal side of that. But yet, so the IAC is not. But yet, IAC is considered their standard for training. So what you're saying is that the IAC would have to be the legal team in order to provide the training that's considered acceptable for that process. Just from my understanding, and I might be wrong, but the commissioner could comment on that too. So.
I found that all the IAC training is very adequate when it comes to open meeting laws and protocol. I've never, felt lacking in any sense.
I'm just, my past experience with board training, it was and it was pretty substantial. And I think his rationale for doing that is he wanted to make sure that, and I'm not saying that the Association of Counties isn't going to provide adequate training, but he wanted to make sure from a legal standpoint that we were well aware of the parameters that we should.
Any other comments?
I just have a question for Dr. Johnson. You mentioned that legal was involved in the training for the IAC. I think that's great. I mean, all training is free training, wherever you can get it. But is Mr. Grigg, is he the one who's the facilitator, or is there also legal counsel present for those trainings?
I forget the name of is it ICRIMP? Yeah, so I think ICRIMP is the one that is associated with that, to my understanding.
But is there an attorney present facilitating the training in addition to Mr. Grigg, or is he going to facilitate?
They didn't define that, but one of the subtitles to the invitation was to they call it a workshop. It's a workshop for the whole day, so they're going to cover many topics, and among those topics was that topic.
And I imagine that's a very robust training, but
Right.
A couple of us going tonight, apologies. Peggy, I think that mispronounced your last name. I know that our office had recommended that Fonda Jovic provide a training to the board, specifically not about like any and all issues that government officials may face, but about Idaho's open meeting laws and the Ethics in Government Act. And so that invitation still stands. We offered that a while back, but the board hasn't taken that up. But again, please engage in any and all training that you would like to do.
Any other comments? Do I hear a motion? No motion?
I'll make a motion that we go through.
Okay, do I hear a second?
Second that.
Okay, roll call vote.
Chairman Fletcher,
IAC training?
Chairman Fletcher,
Yes. Oh, well, let's state the motion, please. The motion is IAC training, yes?
Yes.
Okay, so an affirmative would be in agreement with that. So affirmative, yes?
okay. Dr. Johnson,
Yes.
Commissioner Bertling,
Yes.
Dr. Nolan, Peggy Kavala.
Okay, thank you. Now on to item 9. We're going to go into executive session, and I'm going to request that everyone leave, including legal counsel. That's correct. You are. We don't need you. You have no statutory reason to insist on staying. I don't need to tell you. Yeah. Oh, all right. So we have a dilemma here.